Hello everyone, my name is Jazin May Elam Musao. So today I'm going to demonstrate on how to transfer a patient from bed to chair and from chair to bed. So transferring a patient from bed to a wheelchair or a chair increases mobility status and prevents complications of immobility, increases independence and promotes self-esteem. A transfer or gait belt used to maintain control and for additional support. Before we proceed to our procedure, we need to have the following equipment that needed for this field. First is we need to have a wheelchair or a chair, and second is we need to have a transfer belt or a gait belt, but in my case, I'm going to use my hands. Before we proceed to our planning, we need to wash our hands first before we enter our patient's room. So hello ma'am, good evening. So I am Nurse May and I am your nurse for today. So I am going to transfer you from bed to chair. And may I know your name ma'am?
I'm Jean.
So how are you feeling today ma'am?
I'm fine.
Are you feeling dizzy or are you in pain? Also, as the first step in planning, in planning to transfer the patient from bed to chair is we need to position the chair or a wheelchair into a strongest side at a 45-degree angle or parallel to bed. So next is assist the patient to side lying position and lower side rail and stand near the patient's hip with foot near head of bed in front of and apart from the other foot. Can you move aside from the bed, ma'am? Can you bend your knees, ma'am? Swing patient's legs over bed and at the same time pivot your back leg to lift patient's trunk and shoulders and keep back straight and avoid twisting. Twisting support patient's upper back as they come to sitting position. So can you put your hands on my shoulder, ma'am? And then in count of three you need to up. So 1, 2, 3. So stand in front of a patient and assist for balance. Support in sitting position on the side of bed and have a patient slide buttocks to edge of the bed until feet touch floor and make sure that patient has non-skid soles on shoes or socks and take your patient time to rest because they may feel dizzy from moving and lying to a sitting position. So can you move aside from bed, ma'am, from the edge of the bed? So are you feeling dizzy, ma'am?
No.
No. So I'm going to next is have a patient place their hands on your shoulders on the mattress or either side of their body. So place your hands under the patient's arm and have your knees against patient knees as patient stands. So can you hold on my shoulder, ma'am? So in a count of three, 1, 2, 3, go. So pivot your back foot until patient feels wheelchair or chair against back of legs and keep your knee against the patient's knees and move slowly and have patient grasp armrest. So we need to move aside ma'am from the chair. Can you feel the chair, ma'am?
Yes.
So we need to sit down so slowly. And next is flex your knees and hips while assisting the patient into wheelchair or chair. Assist patient's alignment and make patients comfortable. Are you comfortable with this, ma'am?
Yes.
Okay, so that's it for the moving chair and from moving bed to a chair. So in moving from chair to bed, make sure that the person's strong side is beside the bed and make sure that the both feet flat on the floor So next is ask the persons to move forward in the chair and make sure their tools are under their knees. So we're going to move from chair to bed, ma'am. So are you feeling dizzy or in pain? So we need to move from chair to bed. So we need to stand up. So can you put your hands on my shoulder, ma'am? So in a count of three, we need to stand up. So 1, 2, 3. So next is stand in front of the person and ask them to sit tall, lean forward, and push down on the chair. Arm rest as it help them to stand. And place your hands around their upper back if they have a weak arm, and place your arm around it, not under it. Do not pull on the weak arm, and help the person to move their feet until their bottom is over the edge of the bed. Help them to sit down. The person should reach for the bed and bend their knees, keep shoulders forward. So we need to move, ma'am. Can you feel the edge of the bed, ma'am?
Yes.
So move slowly. So that's it for the return demonstration of transferring a patient from bed to a chair and from chair to bed. So this is Jazin May A. Lamusa, a student nurse of Southwestern University, and that's it for today, and thank you.